recent reports prepared by Georgetown University. The cost of covering the newly eligible population per year is approximately $300 million to the state. And the savings, though, that you offset for that would be savings to the safety net, because they would have more insured individuals that they're treating, $200 million. Savings through state mental health and substance abuse programs, because many of the people they treat with these with the dollars that are 100% out of our state budget for those programs, and many of their patients are not eligible for Medicaid because they're not yet disabled or they don't have minor children. Those people will now be in the Medicaid expansion population. So their services, their mental health services, their substance abuse services will be reimbursed 100% by the federal government for the first 3 years, tapering to 90%. That's a savings of $250 million. The medically needy program, which I know you're familiar with, and don't want to digress too much into that, but that's something that, again, we're paying now almost half of the dollars for medically needy population when those people who have a high deductible become eligible, usually through hospitalization. Those people will now be, many of them, covered under the Medicaid expansion, so we'll get 100% reimbursement. When you net those costs, those additional costs with those additional savings, you end up with approximately $100 million a year saved to the state by implementing Medicaid expansion. And that's not counting all the additional money that comes into the state by virtue of having a million new insured individuals with increased funding for federally qualified health centers. They'll stand to greatly benefit with the ACA for nurses, for other healthcare practitioners, clinics, and so on and so on and so on, not to mention all the other sort of ripple-down effects of a healthier workforce, because workers will be able to get their diabetes and their blood pressure treated at an outpatient low cost.
I understand.